Okay, good afternoon, and it's our Monday, so we're both here today, and of course looking back at what happened over the weekend, and what was announced today, and what we're looking forward to as the week goes on. So, as you heard today, we have announced an additional 7 regions in Ontario that will be in the position of moving to Stage 3 this Friday, and that's also in addition to the other 24 we announced last week. That gives a total of 31 that by Friday will be moving to Stage 3. This was based on discussions with the local medical officers of health. Also, we've been watching for their 4 weeks of data to see if there has been a continuing trend, improvement of their rates of infection in the various regions, and to see if it was below the provincial average, which all these 7 have maintained, and to understand if there's been no significant impact in their areas during this time of Stage 2, and there hasn't been either. We also noticed that thus far, the ones moving to Stage 3, we've seen some issues. I know that Dr. Yaffe may talk about that in a moment, where there have been some changes in some points, especially related to informal social gatherings, not specifically to any organization or retailers opening up in specific detail to Stage 3. The 3 main regions that have not opened yet are Toronto, Peel, and Windsor-Essex, and they'll be remaining in Stage 2 for the time being, as they have not yet completed 4 weeks of data, and we are still noticing that they are around or above the provincial average. We have seen Peel having some increased rates in just this last week, and we're hoping that will abate as the week goes ahead, and we're looking to see if that will continue to improve. I understand that Toronto is also interested and has concerns about moving to Stage 3, especially related to restaurants and bars, as some other provinces and territories and other parts of North America have had issues opening up too soon with bars and restaurants, and some aspects have been tendered for more discussion in that matter. And we are looking at the numbers, if you notice, over the weekend, whereas last week we had stayed below 150 for the whole week. We did jump up over 150 for 2 days. As Dr. Yaffe noted, we're down below that again today. And those related to specifically large numbers or outbreaks, especially in the Windsor-Essex area, related to our migrant farm workers and some other community-type outbreaks. And so we're trying to understand that, as well as looking at some other outbreaks and other health units that put our numbers up above 150. And so we're hoping as the week goes on, those may settle down as they contain those outbreaks and deal with their further testing and follow-up of the case contact management. So in the essence, we have 31 out of 34. And as I said before, we're really trying to press hard. The message here is that the staging allows the public writ large, as they move into these different levels, that way you get to do more and experience more back into what they used to be the previous normal. The way you do it is not the previous normal. And that means you still maintain those public health measures. And that's most important. The distancing, the wearing of a facial fabric cloth covering when in public or areas that you can't maintain, or where it's mandatory, as laid out by different bylaws and orders by local medical officers of health. And by saying if you're sick, stay home. If you don't have to go, don't go out and around if you don't need to. And of course, if you are symptomatic, do go and get tested and be able to recount who your contacts have been and where you might have acquired, because you had to get it from someone. And so these are all important steps to practice and do well, because it's hoping that as we keep working at bringing Stage 3, that we will not have any upsurge of cases, that any risky areas are dealt with very quickly, and asking people to not relax too quickly, to be focused on maintaining those aspects, because the better we do in Stage 3, it has impacts as we go forward, especially as we start to consider opening schools and education in the fall. We know that if the community transmission is very low, the risk to schools is also low. So this is the forward investment rather than saying we've opened this up and let's throw caution to the wind. That is not the message. And some have tended to do that, especially some of the younger ones. I know Dr. Yaffe may have some data to allude to that. So that is not the message. And these younger people can also contaminate younger students, especially those who might be attending educational institutions. And so you need to take caution and not expose yourself, because even though you may think it might be a mild illness, we do not have all the data in yet that some people, even younger ones, have noted having ongoing symptoms that seem to be related to their COVID-19 acute case history. So we want to be careful. We want to avoid obtaining COVID-19, and we want to definitely suppress any transmission of COVID-19. So we have to keep that vigilance going forward into the stage 3 level and try to identify if everybody can do stage 3 and still do all the public health measures and still keep the numbers down and going down as we go into the month of August. So with that, I'm going to hand things over to Dr. Yaffe for data and other comments related to the numbers for today.
Okay, thank you. Good afternoon, everyone. So on Friday and over the past weekend, Ontario reported 111 new cases on Friday, 166 on Saturday, and 164 on Sunday. Today, we're back down to 135 new cases, bringing the total to 37,739 cases in Ontario. As has been the trend for some time, most of our health units, public health units, are reporting 5 or fewer cases. In fact, many of our health units are reporting no new cases at all. Over the past few days, the majority of cases have concentrated in Peel, Toronto, and Windsor, Essex. We've also seen an uptick in cases in Ottawa, with 19 cases on Saturday, 16 on Sunday, and another 20 reported today. The vast majority of these new cases are in people in their 20s, and they are largely related to having attended private parties. So this is a trend that we have seen over the last few weeks, more young people testing positive for COVID-19. I know that the Premier and Minister of Health touched on this during the 1 p.m. press briefing today, but it does bear repeating. As we know, COVID-19 can be a serious illness, and while young people may not suffer from serious symptoms or complications, they may pass it on to someone who's older or has underlying medical conditions. With higher risk businesses and services opening in stage 3, we all have to continue to act responsibly and respectfully to keep family, friends, colleagues, and neighbors safe. And I know, as Dr. Williams just said, this really means the basics: maintaining your physical distance of at least 2 meters from people outside of your social circle or household, wearing a face covering when you're indoors and in outdoor spaces where physical distancing is a challenge, hand washing your hands frequently with soap and water, covering your cough and sneeze, try not to touch your face, and stay at home and away from others if you're not feeling well. I know you've heard us say this many times, but it is for a good reason. What I just outlined are the basic things that will keep us moving in the right direction and keep our rates of transmission low. Your continued vigilance and collective efforts to protect yourselves and loved ones from COVID-19 is central to our ability to control the spread of this disease. I'll now turn it back to Dr. Williams. Thank you.
So thank you. And we're continuing to monitor our lab testing. We did well on that, and we'll continue to look at our positivity rate. It did climb a bit over the last day. We got down to 0.7%. We're hoping to drop that down lower as we proceed in the future. So with those points made, I'm going to turn things over for media for questions.
We'll go to the phone lines. Just a reminder, 1 question, 1 follow-up, and please join the queue if you have any questions. Over to the first question.
Your first question comes from Jason Vio with CBC Wind. Please go ahead.
Good afternoon. So you touched on this at the beginning, but within the last week, the hospital in Leamington says they've noticed a significant rise in COVID cases at their assessment center and the emergency department, with an increase in community spread in addition to the agri-farm sector, prompting them to revert back to phase 1 of the visitor policy. And they say many of the people who show up are showing up quite sick, and their a COVID unit went from 50% capacity to 100% capacity as well. So a number of different signs here. How concerning is all of this to you, and what more is the province doing or will be doing to address the situation in Leamington?
So I was made aware of those increased cases, and that was most concerning to me over the weekend. We had a number of meetings related to that issue. We continue to be updated by Dr. Ahmed and his team at Windsor-Essex Health Unit, and get an idea of what those cases composed of. As you noted, there was a sudden increase in people presenting to Erie Shores Assessment Center to be seen, and of those, there were 3, at least initially there was more, but then ended up with 3 hospitalized, and I understand 2 were quite ill. And so that was very worrisome, especially because they were not directly related to the farm outbreaks and more related to certain parts of the community in the Windsor-Essex area. So in response to that, we had a number of meetings to discuss the direction of the way forward. What further support should we ensure that are there? If we're seeing this is a progressive increase in cases coming forward, then we want to make sure we have enhanced the services that are available there, both for the hospital services, with the Windsor Regional Hospital as well as the Leamington Hospital, as well as looking at the assessment centers to make sure they have the adequate testing. We have our testing units if we have to do some larger community testing. So a number of approaches were looked at. How do we resource the Windsor-Essex Health Unit team to make sure they have enough on the ground as this has been added to it? So as I said, this is a different presentation that is more in community, and some subsections of the community that seem to be impacted more than others, as well as some are related to some retail locations in the community with outbreaks reported there as well. There are still new cases being reported in the farming community that we noted, and while some of those larger ones were quieting down and coming into levels of resolution, some new ones, small numbers mind you, have been noted. And we have not given up on that aspect as we continue to proceed with timely testing, early identification of cases and outbreaks, if they do still exist, in the various farms related to their migrant farm workers. So, yes, I was very concerned with what's happening in Windsor-Essex. We have briefed our different leaders up top, they know about it, and we have put in place some steps to start to rectify and to resource up to make sure, if it continues to accrue, that we have enough people on the ground to respond in all fronts there to make sure it's handled in a timely and effective way, and to work hard to reduce any further hospitalizations in that, and reduce transmission and contain it in the community side as well as on the farm situation. So thank you for the question.
Follow up?
You mentioned a number of different approaches are being discussed amongst many different officials. When will we see additional action taken, specifically in Leamington or Windsor-Essex more generally, and what specifically will that look like?
So in consultation with the local leadership there, with Ontario Health, as well as with the Medical Officer of Health and with the hospital leadership, the question is that in some of these areas, if we're going to do more intense testing of various subsections of the communities in the Windsor-Essex area, then are we going to get to be able to negotiate that testing? So we're wondering about doing some area-wide testing with some sub-communities in the group. We're looking at mobilizing our so-called EMAT team that was down there and is still down there, but they could be utilized to support further both the health unit and the hospital services in measuring or dealing with any gaps and spaces. We still have in place our IMS team that's related to the work with the Canadian Red Cross in supporting the hotel isolation that is used for the migrant farm workers. So we've added that in there. We've added extra resources from the federal government to assist in the epidemiological analysis. And so we continue to do that. We've mobilized some of the health units around that. They and their staff are able to assist in either in many ways with mutual aid agreements if needed. So it's been all front approach to this and trying to get prepared. Hopefully we can contain it fairly quickly, but we want to wait until the situation is assessed properly.
Next question, and this will be the last question unless anyone else joins the line.
Your next question comes from Cynthia Mulligan with City News. Please go ahead.
Hi, doctors. Dr. Yaffe, you were talking earlier about younger people, and you mentioned Ottawa that has had an uptick, and then you mentioned that it seems to be a trend and that they're largely going to private parties. Is that Ottawa only, or now the majority of cases among young people that you're seeing?
Well, I think we have seen an increase in cases in young people in general. I can only speak to the Ottawa experience because the medical officer of health has specifically connected with us about that. Certainly the experience we're seeing in other jurisdictions is young people going out to bars or private gatherings, and so it wouldn't be unlikely that it's happening across other parts of Ontario. And what we're trying to say is it's easy for people to forget that we're still in a pandemic and to go back to what they used to do. And as you will see the effects of that. The disease is still around. It will transmit. And it may not be those young people who are severely affected, but it could be people around them. So Ottawa has specifically identified this in their data. They are looking at increasing their case management staff, looking at potential bylaw changes for gatherings. They're looking at mobile testing outreach. And I know that other health units are actively looking at their data as well and doing measures. So this is something we want to make sure people are aware of and keep, on the lookout for and be vigilant.
Follow up?
So my question then is, do we need to change the strategy on how to reach young people? And listen, I get it. Everybody's going a little bit squirrely by now. But do we need to change the strategy? And should we really be allowing bars to open indoors when we've seen what's happened in Montreal?
So we are looking always at strategies, especially how to get the attention of the younger age group. As you say, have been a little bit of cabin fever, and we hope it's a short-lived sort of burst and then coming back into some more standardized. We're trying to open up many of these different areas as best as possible. We're asking them to continue to look at having the proper measures, the masking in public, as well as their social circles, their circle or group of friends that they know, and to utilize that for the moment, knowing that we're still moving forward into a phase 3 in this time. And so we're trying to find different ways that would require to take responsibility. And as we've alluded to before, we've heard of cases where there have been so-called similar parties down the States, and we've had a 31-year-old die who basically, before he died, said, I guess it was a bad idea. And it was a bad idea. And I think this is the thing, is that you have to think ahead of the consequences. And how do we encourage that? Because not only you might have the potential of dying, and we have seen people, especially in the States, dying at younger ages, but you also can spread it to susceptible members of your friends and your family. And some of your younger people do have immunocompromised states, so they have to be especially looked after and cared for so you don't spread it with them by being casual and irresponsible. So the aspect on the bars, we continue to be looking, is that, as I said before, when we're talking about opening up bars in stage 3, it's not opening up bars as they did and as they were before. It's opening up bars in the new normal. That means distancing. See people sitting at separate tables. Some are using patios. It means not getting up and roaming around and socializing in large groups. People want to have that service available. But as some have noted, there's concerns that maybe we have to be maybe more restrictive if people cannot be responsible, and I'm expecting the owners to do that. We've always had our Safe Server campaign with training people to serve people so they don't put them in a dangerous state, especially the ongoing issues of drinking and driving and aspects there, and doing it responsibly. I think we have to also have that you can serve safely too, and that means in the safe setting with the right format. So if there are cases and concerns and issues, we'll have to address that if it does occur, working both with our local medical officers of health, and as you've heard from Toronto, they have concerns, and it does allow, if there was really of great concern to the mayor, that they could put through a Section 22 order related to the Dr. Davila's role as medical officer of health in the City of Toronto. Because when we gave Section 3, it means you can open up to this amount. You can always bring that down lower in various municipalities as you see fit, or the concerns in your local jurisdiction that you might want to limit that even further. You can do that, knowing that we have a wide variation of cities and size and towns and locations, and we want to try and be as sensitive as we can to those local issues. But if it's a broad, wide issue, we'll have to readdress it in that. So that's a long answer saying we're trying everything we can. And as we've trusted all along, we want our citizens of Ontario to take our direction seriously so that we can stage-wise continually move towards containing COVID-19 and allow for the resumption of a lot of normal activities, but in a new normal way. And that's what we've already alluded to there. So, yes, we want the young people to be really responsible at this time and take this seriously. So thank you for your question.
Next question. This will be the last question.
Your final question comes from Rob Ferguson with the Toronto Star. Please go ahead.
Hi, doctors. Just to follow up on what Cynthia was asking there. So John Tory has this request in for a little bit more stringent rules for bars. So the Premier at his 1 o'clock newser said that's an option. Where do you guys stand on that?
Yeah, we did receive the letter. I thought there were some good options in there that the mayor had noted. I think those are aspects, as we said before, that some municipalities, if they have a lot of dense, heavily used bar-type facilities, could put some limitations in there to decrease the risk-taking behavior, if you may, of the patrons who might utilize that, and to ask the owners to keep those limitations in place. So I thought a number of the suggestions were ones that you would think they would be realistic for most of the owners to do. But if they need to make them more enforceable, as I mentioned before, and I think as the Premier was alluding to, that nothing precludes the fact that the medical officer of health could write an order and the city could choose to limit the activities of those institutions in their jurisdiction boundaries in ways that Mayor Tory was alluding to. So nothing precludes them from doing that. And I think if this is deemed to be a higher risk situation in the certain jurisdictions, that cities and medical officers of health could undertake to do that as they assess their situation and assess how the experience is going in the early stages of Stage 3.
Follow-up, this is the last question.
Okay, thank you. And as a follow-up, just as we go into Stage 3 a little more, do you have, I know it's hard for you to give hard and fast parameters for when you might want to put the brakes on things, but, you know, do you have any numbers in mind? Like if we get back up to steadily over 200 cases a day or steadily over 300 cases a day, where in there, or where would you draw the line at some of these things that have happened and want to pull something back?
Well, our public health measures table is looking at the data because Stage 3 comprises of so many things opening up, and asking our public to say, can you do it in the constrained way of all of what I noted before about the proper measurements and et cetera, the new normal way of life at this time with COVID until there's a vaccine available or it abates totally. We're going to have to practice this and do it well in all settings, regardless of how many have opened up. If we find that certain settings, much like we did with Stage 2 with the nail salon, that alerts us to saying this has to be addressed much more stringently. If we find there's certain risk places that are occurring, like you're alluding to bars or restaurants, where our request with the overall, here's the limits to work within, and if you still find that's being violated, then we may have to take further steps to do it. So there's ways to limit certain places if they're identified as too risky. We could go that way. If you're talking about a whole movement back, say from a Stage 3 to Stage 2, and that's why we staged it, we're hoping not to do that writ large, in there, and as part of the experiment and our testing of how we're doing in each of these stages with the 4 weeks of data to see if we're having outbreaks and clusters like Dr. Yaffe alluded to with the young people doing the informal backyard gathering. Well, that's not ratified in stage 2 or 3. It's just being irresponsible with gathering regardless, which is outside of our group of originally 10 and 50, and probably taking close contact as well as lack of 6-foot distancing. And so that is basically a less than responsive way of dealing with the public health measures no matter what stage. And how do we, as previously asked, really impact that group to say you need to stay the course on this one, at least for this time until we get out of this, or we're going to be at this for a while in a slow, like someone alluded to, a slow burn type process over time. So I would say, Rob, we're going to be asking health units to assess what's happening in their respective jurisdictions as they move into stage 3. Are they seeing anything that are particularly concerning to them? And we're going to be advised by their experience and knowledge and by the data to strategically target what we might do if it did get increases in those areas rather than writ large moving right back to stage 2, for example. So far we've seen there tends to be more specific activities and groups that are concerning.
Thanks, everyone.